The rising burden of disease is a great challenge facing our country today. While India is still battling the bane of communicable diseases, non-communicable diseases such as heart ailments, cancer, diabetes and so on that largely account to premature death and disability are rapidly increasing. Almost 2/3 of the deaths happening in the country are due to non-communicable diseases and their complications.
In fact, as far as the disease profile in the country is concerned, we know that until about 20-30 years back, it was mainly the infectious diseases which were responsible for a large number of deaths in the country. But now for the last nearly 3 decades, we are also being faced with the increasing burden of non-communicable diseases. So therefore, countries like ours are being faced with the double whammy.
In this scenario, mHealth or technology-enabled healthcare delivery holds great promise to help reduce this double burden.
It's not possible to get a specialist in every community health center or a primary health center. And technology can reduce that geographical distance by being able to take the test results and immediately communicate them to a specialist who may be at an urban center and get that advice.
SMARThealth or Systematic Medical Appraisal Referral and Treatment is a mobile health platform developed by the George Institute for Global Health India that helps the doctors and health workers screen the high-risk factors of non-communicable diseases among people. SMARThealth project uses an innovative approach of engaging multi-purpose health workers or ASHAs who are familiar with the neighborhood to carry out procedures like weight, blood pressure and blood sugar measurement of the patients. The app is designed in such a way that the information recorded by the ASHA worker is automatically transmitted to a remote server and then to the doctor in the nearest primary health center. If the app flashes a high-risk sign, ASHA workers refer the patient and the data is transmitted to the primary health center doctor to act. This clinical decision support system helps the doctors to identify and treat high-risk cases promptly.
Our vision was to try to break these components of the technology down into small bits, use our expert knowledge in developing healthcare delivery guidelines.
हर आशा जो इस प्रोजेक्ट में हमने सेलेक्ट की है उनको ट्रेन किया गया हमने कि भाई ये सिम्टम्स हैं, अगर मान ली स्मोकिंग है, ड्रिंकिंग की हैबिट है या जैसे मतलब और कोई लाइफस्टाइल जो हम गलत अपना रहे हैं, आगे आने वाले टाइम में कोई बीमारी होने के चांसेस हैं, तो वो हमने उनको ट्रेन किया है.
ముందుగా అయితే బీపీ పేషెంట్లు పెద్దగా పీహెచ్సికి వెళ్ళి చూపించుకునేవారు కాదండి. మేము ఇంటికి వెళ్ళి బీపీ చూసి షుగర్ టెస్టులు కూడా చేయడం వల్ల వాళ్ళకి రెఫరల్ కార్డులు అవి ఇవ్వడం వల్ల డాక్టర్ దగ్గరికి వెళ్ళి చూపించుకునేవారు. డాక్టర్ గారు కూడా తక్కువ సమయం పట్టి త్వరగా వాళ్ళకి టాబ్లెట్లు అవి రాసి ఇచ్చేస్తున్నారు.
This process has benefited a large number of people in rural areas by helping them gain awareness on the seriousness of treating non-communicable diseases and following healthy lifestyles.
మహాలక్ష్మి రాకముందు ఏమి మాకు తెలిసింది కదండి, మంచి చెడ్డానండి. ఆవిడ వచ్చాక బీపీ షుగర్ చూడటం కూడా అనుకూలంగా ఉందండి. మహాలక్ష్మి అంటే ఆవిడ వచ్చాక మాకు అన్ని విషయాలు తెలిసిందండి. ఆవిడ వస్తాం వల్ల చాలా మంచిదేనండి.
They have screened more than 50 to 60,000 people. Where that is the difference between us and the SMART. They have used the ASHA's help. Here in state government we have used the help of the AMs. Still down level they have gone and they have trained the ASHAs by supplying the same tab pieces for them.
These kinds of experiments in mHealth offer tremendous opportunities for countries like ours to address the pressing need of combating the burden of disease. Today, the learnings from this project are being applied to the diagnosis and treatment of other areas such as common mental disorders, which are high in terms of disease burden but have received very little attention.